When reviewing the evidence presented in this literature review, the literature clearly shows a need for a structured mentorship program to transition novice nurses into practice, especially in critical care. Studies demonstrate that present-day novice nurses face challenges during the transition into practice, amplified in specialty units. The workload, low threshold for stress, and low confidence level can lead to transition shock when first beginning practice, leading to a higher turnover rate. Having a mentorship program and mentor to guide, teach, and role model will help alleviate these feelings and build necessary clinical skills. What is known about mentorship program benefits is that it increases novice nurses' confidence, competence, and socialization within the organization, decreasing the turnover rate. Several studies indicate that competence, confidence, and socialization are essential in the transition of novice nurses into practice, as it allows for professional development, organization assimilation, a sense of belonging, and increased quality of patient care, leading to positive patient outcomes. One competence level that needed further investigation and research was critical thinking. In the ICU, this is an essential skill to possess and adapt to an environment that is high risk, stressful, and emergent. Research demonstrated that socialization was necessary for success in the novice nurse's transition to practice, and that with a lack of mentorship programs, there was low engagement and communication between novice nurses and their coworkers, decreasing their feelings of support and sense of belonging and security. The literature also demonstrated how, with increased confidence, there was an increase in decision-making, patient care, and problem-solving from positive feedback and working with mentors. However, it lacked a timeline and the gauge of confidence they felt from when they were first hired in to after the end of the mentorship program, specifically in the critical care unit. Most of the literature agreed that the turnover rate decreased with mentorship programs due to the increased job satisfaction, confidence level, and socialization. What is known about the mentor-mentee relationship is that it plays a vital role in the mentorship program, and if not paired correctly, can have a detrimental and negative impact on the novice nurse's transition. There is a lack of study on these relationships, specifically in the critical care unit. Hence, unable to verify if mentors in the same unit would be beneficial. 4 studies found the importance of matching the mentor and mentee with personality and learning teaching styles in promoting positive transition. Maximum benefits were demonstrated throughout the literature with regular meetups and prolonged orientation time. Future studies should focus on experimenting with different pairing methods and what works best and is most beneficial for the mentor and mentee. Mentor training also demonstrated the success of implementation of mentorship programs. When training novice nurses, it is essential to know how to guide them to think critically, problem solve, and make appropriate decisions in patient care to maximize positive patient outcomes. Also, utilizing coping strategies to deal with stress and end-of-life situations in the ICU is essential for critical care mentors to develop and have, and to also know when their mentee is stressed or going through transition shock. Finally, the research elaborated on other retention strategies for novice nurses besides mentorship programs. Goldsworthy 2021 implemented a simulation education-based program which showed the benefit of simulation with additional education in reducing nurse turnover. Kester 2019 developed a staffing model that showed benefits for the retention of nurses, however, issues with the orientation of new graduates. This study demonstrates how mentorship programs would benefit and enhance previous studies. What needs to be researched is the benefit of these specifically designed mentorship programs in critical care for novice nurses.